Good morning, everybody. Today I'm going to show you how to do a clinical submission. There's a lot of steps. They're very easy, but I'm going to show you the way on how to start the process. First thing, we got to log into myoptumhealthphysicalhealth.com. The provider ID is 777633. The password is PTNnow12345 exclamation PTN uppercase. We log in. How do you know if a plan is required a clinical submission? The first thing you're going to do is go to Tools and Resources, go to United UHC Quick Group Check, click on it. Get Members Group. Where do you find the Members Group? In the ID cards for United Healthcare, there's going to be a group number on the top right-hand corner. Is usually 6 digits because it starts with letters and numbers. I'm going to use an example on how it look if you need to do a clinical submission. I'm going to use an example of a patient, a group number of W4W2370. Click Submit. Once you're verifying a United Healthcare ID card and you know that, let's say the patient's gonna come in for an evaluation, I always suggest to verify if they're gonna require a clinical submission. So this is one of the steps to know if they will require clinical submission. In this person's patient's group number, it does require clinical submission, and this is the way you're gonna see it. Click here to submit using the online form. There is information that you need to gather first. Once you see this, you already know that you're going to need to do a clinical submission. There's a tab here where it says clinical resources, and it's going to tell you clinical forms. I usually have these forms already saved in the desktop for United Healthcare clinical submission form. This is going to be the patient summary in English and Spanish. This is going to be it's called a self-questionnaire for the extremities, like for the arm, shoulder, hand. There's other ones that are for the back. So depending on where the patient's coming in for the body part that they're going to come and get eval for, here are the self-questionnaires that you're going to be using. It's all here. An example. This one, the patient summary is very important for you to give it to the patient also, because the patient has to put in the information, the provider puts in the information, which is the therapist. Here, you'll see. This is the therapist also. When does they want this submission to begin? I usually put the day of the evaluation. New to your office. This is just a little example of how it's going to look like, and this is what the patient needs to fill out. Once they're done with that, you give it to the patient, you input it, you scan it in and input it into the patient's chart, and then you submit the clinical submission. The clinical submission is going to be, again, go here, you're going to put in the patient's information, the address of the patient, where the patient was being seen, the location, the group number, and here you're going to select the address. Once you select the address, it's going to come out a whole form of what you have to fill out. So everything that you're going to fill out in the form, it's going to be there. Everything that the patient input, it's going to be easier for you, because what you're pretty much doing is the information the patient put in the form that you gave him, you're going to input it yourself for the computer, and then you're going to submit it. It usually takes up to 24 hours. It's very quick. They're usually very quick. Depending how many visits they approved, it could be up to 8 visits, 10 visits. And that's how you do a clinical submission.